I'm Gail Schulteis from Muskingum Behavioral Health. I would like to talk about grief and recovery. There are 5 stages of grief most people are aware of: denial, anger, bargaining, depression, and acceptance. 5 types of grief are anticipating. That can be when someone has a prolonged illness, perhaps terminal, and you anticipate that death is inevitable. The elderly, most people are aware that when you reach a certain age, when you get to be an elderly person, that's going to happen. In addition, complications from drug and alcohol use. Many people recognize that if the abuse is serious enough with the drugs or alcohol, that might happen. Normal grief, which is the most common. Children that have a chronic terminal illness, and again, the elderly. Complicated grief has many different facets. Shame, the shame that a person might feel surrounding the circumstances of the grief, their guilt, that their role that might have played a part in the reason for the grief. Stigma, when somebody feels that they may have enabled the circumstances surrounding the grief. Anger, anticipating the grief. They're angry that this person has used drugs and or alcohol, and that has caused their grief in the first place. Any other kinds of activity that may have put them in danger, their loved one in danger, and caused the circumstances for the grief. Relief is another complicated type of grief. That can be whether there is addiction or there is abuse. The person can feel relief as that is over. They don't have to worry about what the person is doing, where they are, if they're going to get that phone call in the middle of the night because of the drug or alcohol, or they are relieved because the abuse isn't going to happen anymore. Then there's the trauma, complicated grief, and that's having regret regarding the circumstances for the grief surrounding the trauma, and trauma can be many different things. Abuse oftentimes is complicated because of the mixed feelings with that. I am relieved that they're not here anymore, they're not going to abuse me anymore, yet I really cared about them. That might have been my loved one. Prolonged grief is another type of grief. That can be due to a long-term illness, or a severe accident that requires long-term healing, or someone being in a coma for an extended period of time. Trauma is a type of grief. Obviously, combat soldiers that see combat, and anyone else involved in the war, the victims that are involved in the war-torn area. Disasters, whether it's man-made or natural disasters. Complex trauma, when there's a situation that happens and it's a difficult situation, if there's enough time, a person can recover from that. If there's another difficult situation that happens on the heel of that first one, and then a third one and a fourth one, it becomes very complicated, and it makes it very difficult for somebody to recover from those kinds of grief. PTSD, post-traumatic stress disorder. That is an anxiety disorder, and therefore they end up having significant anxiety and depression as a result. They may be left with significant fear that they're not always sure where that comes from. They're not able to pinpoint exactly why they feel so afraid about things they didn't necessarily feel afraid about before. They may withdraw from society and very often have flashbacks about the traumatic event. Mental health grief has many different causes, events that cause the grief, as does drugs and alcohol. Many of them are overlapping. There might be the loss of health, whether you have a terminal illness or a significant lengthy illness. Could be a loss of limb. Diabetes can cause limbs to have to be removed due to gangrene. There can be a loss of an organ, different organs in the body shutting down and having to have a transplant. The loss of a job, where the business has stopped functioning, had to close, or they did something that got them fired. the death of someone that's close to them that they cared about, including a pet. Too often, people don't always recognize the importance that a pet plays in a person's life. Divorce, separation, or a breakup, a failed relationship, can be a reason for the grief. An accident with an automobile, work-related accident, a home-related accident, any kind of an accident that could have caused some serious injury, long-term healing can be significant. Sometimes people don't always put together that a miscarriage or an abortion can cause significant grief for a person. Even the person themselves may not recognize the significance that grief in their life. Moving from one community to another, leaving friends behind, their home, their community, and having to start all over can be a grief-causing event. And the developmental milestones that people go through. So a family who has their first child, the lifestyle they had before the child is something they may grieve. Or when they do have the child and the child first goes to school. Or when they graduate from junior high, high school, college, when that person gets married, grieving the loss of their child as the child grows. And then when that family has their first baby, can grieve the loss of having independence and now they're grandparents and having to take on more role or responsibility there. The drug and alcohol grief, like I said, many of those events that cause grief for that population can be similar. One that doesn't resonate with people is giving up the drug or the alcohol. That can be very difficult. People often recognize that that drug or alcohol is their best friend. They have burned their bridges with their family or friends, and that's the only thing that's left that doesn't go away. All they have to do is go get it, and it's there for them, and it will provide for them what they're looking for. Again, the death of a child because of the drug use or alcohol use, or their parent or sibling has abandoned them and stopped communicating with them. Their true friends that they may have had prior to starting using or getting to the level of a more serious drug use or alcohol use, those friends tend to drop away. Any other losses that are linked to their use, their lifestyle, like I said before, with mental health. However, this lifestyle is much different. They are involved in criminal behaviors, they're involved in lying and manipulating, and that lifestyle all goes away. That can be a difficult grief for people to go through. And of course, they may witness or hear about or know that some of their very close drug-using buddies also died. Other unspeakable deaths, such as suicide and overdoses, murders, even freedom, that they are now incarcerated, whether jail or prison. Children going into the welfare system because of their drug use, their inability to take care of their children the way the children need to be cared for. Again, the abortion and miscarriages, even stillborn children as a result of their drug use. Family abandoning them entirely. Again, the separation, divorce, failed relationships. Sexual abuse often happens more often with drug and alcohol as a cause of grief event, because women especially are more likely to be sexually abused during that time. People may lose their job, their status in the community, even their career. For instance, a nurse or doctor, they may not be able to do that job anymore because of their drug use or alcohol use. They may lose their home, and most importantly, they lose trust with everyone. 4 possible dysfunctional, negative coping skills that people might gravitate to when they're in their drug and alcohol using stages, or even their loved ones may use this to cope. It often prevents them from seeking help. So it's really difficult to take that first step. It may interfere with their ability to address their own grief because they're caring for other people's grief. They may feel very stunned and washed out and unable to move forward. Many times people turn to chemical use, or their chemical use worsens as a result of whatever the grief is, as a way to cope. The dynamics of grief. Death due to drugs and alcohol often has its own immense challenges in the healing process. The community in and of itself is much less compassionate towards people when there is someone in the family who has a drug or alcohol addiction. Grief is one of the most difficult emotions to talk about in the first place, and then if drugs and alcohol is surrounding that, it makes it even worse. Parents are often blamed or seen as deficient when their child overdoses and dies, giving them the message that they don't have the right to grieve in the first place, and that their child's life was invalidated. It didn't matter, didn't amount to anything. Oftentimes people have ambiguous feelings of relief that, okay, now I don't have to worry 24/7 about where is my loved one, what are they doing, are they dead or alive, am I going to get that phone call? And guilt, what didn't I do, what should I have done, what else could I have done? It's my fault in the first place that they got hooked on drugs or alcohol. Unfortunately, the drug and alcohol use still has a very powerful stigma attached to it. Many people still believe that it is a choice. The first time someone picks up drugs or alcohol, it might be a choice. After that, once the disease of addiction is turned to the on position by the gene marker inside them, the drugs and alcohol are what takes over, and they don't have a choice anymore. That's difficult for people to understand. Shame and guilt are due to the immoral and criminal behaviors that people engage in while they're in active use. Expect the following feelings while you're going through the grief. Feeling overwhelmed or numb, not acknowledging the sadness that you might feel, or feeling very restless, unable to focus and concentrate and accomplish what you set out to do. The emotions are all over the place, sometimes even having a difficult time identifying what the emotions are. Withdrawing from society or even family. Feeling lost, not knowing which way to turn. Feeling angry at the person that is responsible for the reason the person's grieving, for whatever the reason, whatever the event was. Physical changes that might happen to a person, they might be trembling, feeling nauseated, having trouble breathing, muscle weakness, their mouth might get dry, having trouble sleeping and eating, either too much or too little of either one, having strange dreams and even nightmares. Absent-mindedness, like I said, difficulty to concentrate and focus. Questions a person might be asking themselves. What did I do? What didn't I do? What do I do now? Who cares? What if I would have done this? What if I would have done that? What if I said this? What if I said that? If only. How can I go on? Treatment can help. Here at Muskingum Behavioral Health, we have qualified and credentialed staff to be able to lend an impartial and non-judgmental ear. We can provide education. We can assist a person to find the appropriate coping skills for them. We can provide new insights and give new hope. Our phone number is 740-454-1266. We can help with chemical dependency grief. We can help with mental health grief. Also, you can call the Mental Health Board at 740-454-8557 for more information. Thank you.